participants will gavel in a couple. Gavel, so we can gavel. And he's done the right thing by not being here. Move forward and to bang the gavel and call to order the hearing on fiscal year 2023. The President's budget for the Department of Health and Human Services, a hybrid hearing, so we need to address a few housekeeping matters. For the members who are joining virtually, once you start speaking, there is a slight delay before you are displayed on the main screen. Speaking into the microphone activates the camera, displaying the speaker on the main screen. Do not stop your remarks if you do not immediately see the screen switch. If the screen does not change after several seconds, please make sure that you are not muted. To minimize background noise and ensure the correct speaker is being displayed, we ask that you remain on mute unless you have sought recognition. The chair or an individual designated by the chair may mute participants' microphones when they are not under recognition to eliminate inadvertent background noise. Members who are virtual are responsible for muting and unmuting themselves. Finally, the House rules require me to remind you that we have set up an email address to which members can send anything they wish to submit in writing at any of our hearings. That email address has been provided in advance to your staff. With that, I want to acknowledge the ranking member of the subcommittee, Congressman Tom Cole, and all of the members of the subcommittee who are joining today's hearing, both virtually and in person. And I would like to welcome my friend and former colleague, Secretary Javier Becerra, in his first in-person hearing of this subcommittee as Secretary of the Department of Health and Human Services. So you joined us virtually last year, of course, but there's nothing like being in person and being able to interact with people. So a very, very, very warm welcome this morning. Today, I'm looking forward to discussing HHS's fiscal year 2023 budget, which builds on the historic progress we made in the fiscal year 2022 appropriations package. In the fiscal year 2022 omnibus, we increased funding for biomedical research, public health, behavioral health, child care and early learning, prevention of child abuse and family violence, and the list goes on. And through these investments, we are able to bring transformational change to millions of hardworking American families. Let me take a second here before I go on to say a thank you to my colleagues on both sides of the dais and those who are virtual today, and a really heartfelt thanks for our work together in passing the 2022 omnibus. And Congressman Cole, I want to say a particular thank you to you for your good offices in all of this. I think we have a bill that we can be enormously proud of. And I would also say that there weren't a lot of folks who thought we were going to get across the finish line, but we showed them. So, and all done by March 8th, when the deadline that they kept changing on us. So, but thank you all very, very, very much for your hard work. And again, a thanks to the staff as well for getting us there. We strengthened in the omnibus bill the Center for Disease Control and Prevention by supporting the public health workforce, continuing to modernize public health data systems, creating a new funding mechanism to support core public health activities at the state and local level. We made strong transformational investments in maternal health with increased funding for NIH research on maternal mortality through the Improve Initiative for the Health Resources and Services Administration's Maternal and Health Child Health Block Grant, and Maternal Mental Health Hotline, and for the CDC's Maternal Mortality Review Committees, just to name a few. We expanded access to behavioral health with investments in the 988 National Suicide Prevention Lifeline, the Mental Health Block Grant, and in certified community behavioral health clinics, as well as a new pilot program to support mental health crisis response teams to ensure that individuals experiencing a behavioral health crisis receive the medical treatment that they need. In addition, for the first time in 12 years, we included funding for member projects to support hospitals and health clinics, mental and behavioral health projects, K-12 and higher education programs, and job programs in our home districts. And now, with the fiscal year 2023 budget before us, we are strengthening these historic investments and ensuring the seeds of change that we planted in last year's bills grow deep, strong, and sustainable roots. I want to be clear, my goal is to pass fiscal year 2023 appropriations bills on time, which means sending them to the President by September 30th. We've already had conversations, and I plan to work with Ranking Member Granger, Chairman Leahy, and Vice Chairman Shelby to reach an agreement on top-line spending levels so each subcommittee can move forward with a renewed sense of urgency. In the immediate term, we need to provide additional emergency funding to address the ongoing COVID-19 pandemic, to purchase life-saving vaccines, antivirals, monoclonal antibodies, as well as continue support for the uninsured to receive vaccination and testing at no cost. Surgeon General Admiral Vivek H. Murthy wrote in the New York Times on Tuesday, and I quote, "Now for the first time we cannot order enough vaccines to provide boosters for all Americans if a fourth dose is deemed necessary in the fall. If we need variant-specific vaccines, we will not have the funds to secure them, deliver them, or administer them. Last week, we were forced to cut our shipments of life-saving monoclonal antibodies to states by 35%, and we anticipate running out of monoclonal antibodies later this spring. We will not be able to continue making home tests available and the critical surveillance efforts that help us anticipate new waves and variants will be compromised." End quote. Let me also add that it is equally critical to support global vaccination efforts, both from a humanitarian perspective and our own self-interest. Viruses do not stop at borders on a map. No amount of domestic preparedness can possibly contend with a continuing onslaught of new variants. As of today, only 1 in 10 people in low-income countries are fully vaccinated. To achieve the goal of vaccinating 70% of each country's population, including health workers and the elderly, the United States must take a leadership role. It is urgent that we act now to secure funding to address the ongoing pandemic before the money runs out. I urge my colleagues on both sides of the aisle to come together to save American lives and to save lives across the globe. And it is urgent that we move in this direction. Mr. Secretary, I am pleased to see your long-term plan for pandemic preparedness. The President's budget includes $82 billion over 5 years to invest in the Office of the Assistant Secretary for Preparedness and Response, ASPR, the CDC, the NIH, and the Food and Drug Administration, to be able to identify new potential pandemic and move quickly to develop a vaccine and deploy it within 100 days. We also need to tap the potential of the Advanced Research Projects Agency for Health, otherwise known as ARPA-H, which we created in fiscal year 2022 in the omnibus to support transformative research projects to address debilitating diseases like Alzheimer's, diabetes, cancer, ALS, and many other health conditions afflicting millions of Americans every day. ARPA-H has tremendous potential to develop breakthrough technologies and advancements while continuing our important work to reduce health disparities. However, Mr. Secretary, you know my view on this. I must say that the decision to place ARPA-H within the NIH, I believe, is a mistake and will hamper the agency's ability to achieve these breakthroughs. I believe that ARPA-H would be more successful in its unique mission if it were established as an independent agency within HHS. And I also believe that the proposed increase of only $274 million for the rest of the National Institutes of Health is insufficient and threatens the project this committee has made in the past several years through significant, sustained investments in biomedical research. Beginning in fiscal year 2023, the President proposes to reclassify the entire Indian Health Service budget, approximately $9.3 billion, as mandatory, and I look forward to hearing more about the need and the rationale for the proposal. Mr. Secretary, I'm happy to see that the President's budget continues to build on our investments in public health, maternal health, behavioral health, including significant increases for CDC's core public health capacity, as well as increases for SAMHSA's mental health block grant, substance use prevention block grant, state opioid response grants, certified community behavioral health clinics. The budget includes targeted increases to improve mental health services for children and youth, including increases for Project AWARE and the National Child Traumatic Stress Network. It includes increased funding for mental and behavioral health workforce training, which is critically important. These investments will help make quality care more accessible for those suffering from mental health disorders, as will the July rollout of the new 3-digit number 988 for the National Suicide Prevention Lifeline. This will be a dedicated number for individuals in crisis to receive help immediately. It is encouraging that this budget expands access to health care services for low-income women by providing $400 million, an increase of nearly 40% over the 2021 enacted level, to the Title X Family Planning Program, which will improve overall access to vital reproductive and preventive health services and advance gender and health equity. I will keep fighting for more money for Title X and other reproductive health programs. Within ACF, HHS is investing once again in refugee resettlement programs. This administration is restoring our reputation in the world as a country that welcomes immigrants of all colors and faiths, as we did for Afghans in Operation Allies Welcome, and as I hope this Congress will come together to do for Ukrainians as well. Let me also tell you, Mr. Secretary, that I expect to see substantial progress this year in the Unaccompanied Children Program. You know my position on this. HHS needs to build a sufficient network of state licensed beds. It needs to shut down the emergency intake sites. It needs to fund the services necessary to support these children and their sponsors as they recover from their traumatic journey and past, and as they navigate the asylum process and understand their legal rights. Mr. Secretary, we thank you for being here today. I look forward to working with you over the next year and look forward to today's discussion. And with that, let me recognize the ranking member, Congressman Cole, for any opening remarks.
Well, thank you, Madam Chairman. I'm going to start as you did. I'm going to be outside my prepared remarks for a minute and do a little look back and before we look forward. And I want to begin, you were nice enough to thank all of us. The rally is all of us should be thanking you and Ranking Member Granger for what you did. I'll point out this committee was ready to go to conference at the appropriate time. All 12 bills had passed out of this committee last year under your leadership, 9 of them across the floor. We were ready before September 30th. And I am particularly proud of how hard you pushed over and over again for demanding the least amount of time, first December, then February. But you were the leader in pushing the Congress toward getting its job done. And there's no more important job than funding the government across the board at every level. And we know, Mr. Secretary, we hobble you and your colleagues when we don't give you a budget on time. It forces you to wonder what you're going to be operating with. It slows down a lot of things that need to get done in a hurry. But that was not the responsibility of this committee at all. It was, again, ready to go to work, ready to sit down with the administration. Our friends in the Senate, I think, could learn a little bit from you, Madam Chair. As I recall, they didn't get any bills across the floor, and they only got 3 out of committee. I know everything's slower in the United States Senate, but really, 3 bills out of committee? Come on, guys. They need to pick up the pace over there. But I'm proud of this committee, even when I disagreed. And of course, initially we did. But I'm also pleased, as you pointed out, for the 7th year in a row, we got to a bill that we both could vote for. And again, that wouldn't have been possible without your leadership and Chairwoman Granger's leadership. And I think we certainly have R&D divisions around here, but we have institutional divisions as well. And I think our institution looked better than our counterpart on the other side of the rotunda. And you bear enormous responsibility for that. So I want to associate myself with your goal of making sure that we make this by September 30th. My guess is we'll do a CR and kick it into the end of the calendar year, but it needs to get done, and sooner is better. On time is best. If not, the calendar year is best. I think, again, I'll pledge to work with you as hard as I possibly can to make sure that that is our goal. It is a mistake to kick it into a new Congress where we will have new members on both sides of the aisle, and they'll have to vote on something that they've had very little knowledge, no participation in, and they deserve a clean start. And frankly, the administration deserves a clean start to the 3rd year as well. And so we look forward to working with you on that. Now let me go to my formal remarks, if I may. Mr. Secretary, it is a pleasure to have you here. And as the chair said, it's wonderful to be back in the room and have the interaction. Particularly good, frankly, interacting with you. As you know our world better than any secretary I've dealt with. I've dealt with some good ones on both sides of the aisle, but it's always nice to have another member here that understands what are the challenges we have from a legislative standpoint, and you do. I'm glad that, again, our chair chose to hold this meeting in our full committee room so that some members could attend in person. I wish we could all be together in person for this hearing, as I think the dynamic and interaction among members is much better when we're all seated together in the same place rather than looking at each other through computer screen. Nevertheless, Mr. Secretary, I appreciate your personal accessibility to us as members. I've enjoyed the bipartisan breakfast you've been kind enough to host over the past years. I appreciate you understanding the challenges of legislating and having served this body yourself, and particularly your responsiveness on the phone or things like that, again, to both sides of the aisle have been greatly appreciated. Today is our annual budget hearing to discuss the administration's budget proposal for fiscal year 2023. We just completed the final funding bill for fiscal year 2022 only 3 weeks ago, so thanks for getting us right back to work, Madam Chair. I'm hopeful it does not take as long to complete the work on the budget this year for the coming fiscal year, and I was glad to see a return of bipartisanship and compromise in the bill recently completed. Although we had strong differences going in, we were able to forge a compromise that both the chair and I were able to support. For more than 4 decades, the Labor, Health, and Human Services Appropriations Bill has carried the so-called Hyde Amendment that restricts federal taxpayer funding for abortion under most circumstances. The fiscal year 2022 budget just completed was only able to advance because this language was again included. Thank my chair for seeing the wisdom in continuing this decades-old bipartisan compromise, although I know that she personally disagrees with it. I'm confident that the next spending bill we negotiate will continue to include it, as I continue to oppose any appropriations bill that seeks to weaken pro-life protections. And Mr. Secretary, I expect under your leadership, HHS will continue to enforce these provisions of existing law. But let me be very friendly but firm. No Republican will vote for a budget in the end that does not have the Hyde protections. And in the end, we know it takes a bipartisan majority in both chambers to actually move this. So the choice is squarely with the administration and the majority. We'll once again be confronted with a choice: either Hyde comes back into the budget or accept a CR. And I want to be clear on that. I'm not trying to be anything else. It's just a political reality. Coming on the heels of such bipartisan negotiation, I'm, again, disappointed the Biden administration once again is putting forward a partisan proposal that seems a little more than a lengthy liberal wish list in some areas. For example, the budget proposes to implement partisan priorities such as climate change, gun research, and even a new Center for Sexual Orientation and Gender Identity within the NIH. To pay for these partisan initiatives, long-standing shared bipartisan priorities are shortchanged. Basic biomedical research at the NIH is essentially flat funded, while the new ARPA-H, which was just created this month, and which, by the way, I supported, has not even begun to function yet, but it's proposed an enormous $4 billion increase. I think it's a mistake to shift funding away from basic biomedical research into a brand new program in 1 year. ARPA-H will take time to get up and running and take time to work out the many controversial issues I know this new agency will face. And I'll have some questions about your plans on ARPA-H this morning. I appreciate, by the way, your letter that clarified some things about it and also made it clear that you want to work with Congress, because this is a very new entity, and we're going to have a lot of wrestling with tough questions. I mean this in a very bipartisan way to get to a structure that we all think is producing what I know we all want it to produce. And again, I say that as somebody that supported the creation of the initiative and look forward to continuing to work with you on that, Madam Chair. Taken as a whole, I disagree strongly with the approach taken in the administration's request. Put it simply, it spends far too much on domestic programs, far too little on defense, especially now with the current situation in Eastern Europe. America cannot afford to stand or cut back our own defense spending. At a minimum, we need to see at least a 5% annual increases beyond the rate of inflation for defense spending for the next several years. But that's a matter for the full committee, not just this subcommittee, certainly. The President's proposal for fiscal year 2023 for this subcommittee amounts to a 15% effective increase. Coming in when the fiscal year is already halfway over, another huge infusion of spending in these domestic programs in fiscal 2023 is just not necessary. And I don't think it can be spent prudently and will only serve to increase our already growing inflation problem, which is now near a 40-year high. I know we're all hoping that the coronavirus pandemic, which began over 2 years ago, may finally be winding down to a manageable endemic disease. Despite the many challenges of the past 2 years, Congress was able to come together 5 times in 2020 to pass emergency supplemental appropriations to help us through the pandemic. I supported all 5 of those bills. I know we are not out of the woods yet. The administration's told us that funding for therapeutics and additional booster shots is running low, and we do not know if new variants are coming in the summer or the fall. Yet the administration has also released documents showing tens of billions of dollars, possibly as much as hundreds of billions, in previously appropriated COVID dollars remain unobligated and available. And look, let me just be brutally honest here and use my own state as an example. Under the proposed future distribution of money, I think we have something like $187 million ticketed for Oklahoma. We have a rainy day fund that we added $1 billion to last year. We had a tax cut last year. And I can tell you that $187 million is unlikely to be spent for corona-related purposes. We don't need the money. And I think some of the revolt we saw on my friend's side, again, was more governors that wanted to use the money for other purposes. If I were comfortable they were all going to spend it on the priorities that you've laid out in your budget, Mr. Secretary, that would be one thing. I'm not. But I'm not for just, throwing money away when we've got hundreds of billions of dollars of money that can be repurposed and aligned for this. And I know that's a political discussion as well as a policy debate. I recognize that, and I'm happy to work with my friends on that. But again, most of these states are in better financial shape, quite frankly, than the United States government is. Most of them have reserve funds. We don't have one. Most of them have balanced budgets. We don't have that. So the idea of us not taking some of the money that we wanted to lay out for coronavirus and saying, no, you guys really don't need it for other purposes. Let's redirect it back, I think is a worthy discussion to have. Mr. Secretary, again, as I said, I urge you to repurpose these existing funds to secure additional doses of monoclonal antibodies and other therapies without delay. I urge you to use the remaining COVID balances as well as the increases we provided in the bill just passed in the NIH and BARDA accounts to continue to work on the next generation of vaccines. And hopefully a universal coronavirus vaccine or vaccine that targets mucosal membranes can be developed quickly and can not only prevent severe disease as our current vaccines do, but can also reduce transmissions and the need for additional boosters. Finally, I want to take this opportunity to comment on one part of your budget, which is not under this subcommittee's jurisdiction, but one which I wholeheartedly agree with your proposal. And that's your proposal to move the Indian Health Service to the mandatory side of the budget ledger. That's a move I believe is long overdue, and it will stop the competition for scarce resources that currently exist between the Indian Health Service and other programs important to Indian country, such as the Department of the Interior, the Bureau of Indian Schools, payment in lieu of taxes, reprogramming. Other programs are important in preserving our nation's natural resources. I hope this can work together to further this idea this year. My colleagues on this subcommittee have had to hear me probably more times than they care to, since it's not directly their jurisdiction. But having said on Interior, the reality is there's just not enough money in the discretionary budget to take care of the needs of Indian health, which is already the largest single item in the Interior Subcommittee appropriation. I think your approach here is a wise one. Sadly, every time we've had a government shutdown or delay in spending because the Indian Health Service is on the discretionary side of the budget instead of the mandatory, we've disrupted health care and reservations and some very poor communities. I think this is a very far-sighted proposal for you. I know you're going to get some stiff resistance on both sides of the aisle for a whole variety of reasons, but I think you're on the right track here, and I look forward to working with you, and I appreciate very much you advancing this proposal in your budget. So with that, Madam Chair, again, I look forward to working with you in the coming year. It's been a delight for 7 years in a row. It's ended successfully 7 years in a row. I hope it ends successfully the 8th time around. So with that, again, yield back to my friend, the chair.
The 8th time is a charm, so there we go. Thank you very, very much, Congressman Cole. Thank you for your kind words as well. I much appreciated, and I enjoy so much the opportunity to work with you in these areas. As you pointed out, we may disagree, but we're never disagreeable about it, and we get to a conclusion, and that's really that's what this job is about. It's about governing. And so, Mr. Secretary, the floor is now yours. Your full written testimony will be entered into the record, and you are recognized for 5 minutes for an opening statement, and then we'll move to questions. You know the drill.
Madam Chair, Ranking Member Cole, and members of the subcommittee, thank you for the opportunity to discuss the President's fiscal year 2023 budget for the Department of Health and Human Services. Pleased to be with you today. Speaking of today, 255 million Americans have received at least one dose of the COVID-19 vaccine. 2/3 of adults over age 65 have gotten their booster shots. We've also closed the gap in vaccine rates we usually see fall behind for communities in some of our distressed areas. It pays dividends to surge resources, including tests and treatments, to our hardest hit and highest risk communities. We think the numbers show that. What are those numbers? 325 million free COVID-19 tests have been shipped out to Americans. 270 million free N95 masks have been made available to Americans. You all made it possible to have $186 billion available through the Provider Relief Fund. So far, we've seen some 766,000 claims submitted by doctors, hospitals, community health centers, pharmacies, labs, nursing homes, long-term care facilities, all of them receiving some very critical support at a very necessary time. More than 450,000 providers to date have submitted requests for reimbursement. Real money, real relief, real results. Beyond COVID-19, today more Americans are insured for their health care than ever before. That includes a record-breaking 14.5 million Americans who secure their health insurance coverage through the Affordable Care Act. In addition, thanks to you, we're now enforcing the new law that protects Americans from being blindsided by surprise medical bills. We launched Operation Allies Welcome, an HHS-led effort that has helped over 68,000 Afghan refugees resettle in America. We're coordinating nearly $300 million in nationwide support for the launch of the 988 National Suicide Prevention Lifeline in July. HHS has also made key investments to improve equity in areas like maternal health, where we've extended Medicaid coverage for postpartum care for a new mother and her baby from 2 months to 12 months. The President's 2023 budget lets us build on that record of investment in America's health. It proposes $127 billion in total discretionary budget authority and $1.7 trillion in mandatory funding, including newly proposed mandatory funding to provide for the Indian Health Services. It also asks for $82 billion for the President's pandemic preparedness proposal to get ready for whatever might come next after COVID-19. Considering that COVID has cost this country more than $4.5 trillion in direct support from the federal government so far, this is a no-brainer to prepare for the next pandemic. The funding we're requesting will be end-to-end for research, development, approvals, deployment, and effective response. Madam Chair, budgets represent not just dollars and investments, but our values and our priorities. This budget turns hardship into hope and inclusion into opportunity. And it's a commitment to finish the fight against COVID-19 and to build a healthier America. On that note, I want to acknowledge our collective national failure to fund the Indian Health Services at the level needed to meet our constitutional treaty and our trust obligations to tribal nations in America. But even more so, to point out how we failed to meet the elemental level of needed support to provide fair and sufficient resources to our families in Indian country. I've seen these shortfalls firsthand in my visits to Indian country, where more than 2.7 million patients are served by Indian Health Services. The President's FY 2023 budget takes a historic first step toward finally delivering on our long overdue commitments to tribal nations. In my written testimony, I detail our proposal to convert the IHS budget to mandatory funding, as Congressman Cole mentioned, and we do this not only because it's necessary, because we have to do it long term. We're so far behind. It bolsters significantly the budgets for IHS over the next 10 years. This budget is a strong start, but we must continue to shine a light and hold ourselves accountable on our promises. Madam Chair, I look forward to working with you and all the members of this subcommittee to make the President's 2023 budget a reality and to continue our efforts to improve the health and well-being of the American people. Working together, I'm confident we can give Americans real relief, real results, and real peace of mind. And with that, I'd be happy to answer any questions you may have.
Thank you very, very much, Mr. Secretary, and thank you for your written testimony, which was, extensive and in detail. Much appreciate the information. I've got 2 or 3 questions, and this is around, the COVID supplemental, pandemic preparation, public health areas. And the administration has told us that more funding is necessary to deal with purchasing the COVID vaccines, therapeutics tests, including covering vaccination and testing for the uninsured. What's the current status of the COVID-related activities that will be reduced or eliminated without additional funding? What are the potential consequences of failing to maintain these efforts?
I start by first saying thank you very much to what Congress has provided over the last 2 years. As I said, $4.5 or so trillion in support overall for all aspects of COVID from the federal government. That's a major investment. What we're asking for now is to finish the fight on COVID. We are running out of the money in that provider relief fund to reimburse claims submitted by all those different types of doctors, hospitals, and so forth. Just to give you an idea, when we told providers that we would have to stop accepting claims about 2 weeks ago, in a period of about 8 days, we received over 2 million claims. We know that what we're going to see now is just a rush for April 5th, when we've announced that we will stop receiving claims as well for vaccination. The first deadline was for testing and treatment. I think it was March 22nd. The new deadline for vaccination reimbursement is April the 5th. We expect another surge of applications to come then. I'm sorry, I think I said number of claims of 2.3. That's what we estimate the number of dollars in claims that we've received. That goes with the $2 to $2.5 billion in existing claims that we're processing as well. We had to call out these deadlines because we didn't want people to think that they were going to be able to get reimbursed anymore from the money that was in the Provider Relief Fund. The Provider Relief Fund has been a tremendous asset to so many for the doctors, hospitals, community health centers throughout the country. We don't think this is a time to stop when we're getting real control over COVID. The Therapeutics, President had us do something very important. He had us buy in advance. And so we not only made the commitment up front, but we were first in line because we made the commitment up front. We can no longer do that because we don't have the monies to make those commitments up front to the therapeutics that we know work. That actually, if you do get COVID, you can be saved. You could be possibly spared going to the hospital. But those therapeutics, whether it's the antivirals or the monoclonal antibodies therapies, we need to make sure we're purchasing and we don't have to get in the back of the line to purchase in the future. That money to do that is running out. We get to the boosters, as we heard CDC and FDA announce. We can do some of the boosting right now, but right now we're talking about those 50 years of age and older. It's going to be tough to continue this without the resources. We hope Congress will work with us to make sure we have that.
Just a comment on, first of all, with regard to CDC, their ability for surveillance and early detection, the impact on CDC of, what we're talking here about, not committing to more resources.
Yeah, well, CDC, by the way, I want to make sure we're clear on something in terms of the president's budget. The president's budget was essentially shaped before we knew if you would pass the omnibus. We were having to base our projections for 2023 on what we knew of the CR, which was funding far lower than the omnibus that finally passed. And so when you see them funding for CDC, it was based on where we thought we could go from the CR funding level. Because the omnibus had funding levels vastly better than the CR, we are certainly going to work with you all to make sure that CDC is appropriately treated when it comes to 2023. But CDC has been the closest partner to our state and local governments when it's come to addressing COVID. And if they don't have the dollars to go out there and do the surveillance, to go out there and communicate to communities what we're seeing, where we see the next wave coming, it makes it very difficult for anyone back home to get ready.
Let me just I'm glad that the president's budget talks about preparedness for the next pandemic, and they've got new mandatory proposals, $82 billion over 5 years. I continue to believe that we underutilize the Defense Production Act and that we should use the DPA to increase global vaccine supply and the pandemic worldwide. And I would note that only 11.5% of individuals in low-income countries have been fully vaccinated, and that has to comment on how, in fact, that does hurt us. And under your pandemic preparedness plans, how will the administration invoke the Defense Production Act? How can this be used more aggressively?
Madam Chair, we have used every tool in that toolbox to secure our supply chains, to ensure domestic manufacturing. The fact that this country was able to produce a vaccine in less than a year is proof of that. The fact that we've been able to disperse it to hundreds of millions of Americans to date. The fact that we have been the leader when it comes to making sure people around the world have access to the vaccine, especially in countries that are further behind the process, is a testament to the work that we've done using the tools we have. We have engaged in a couple of dozen DPA or DPA-style actions over the course of the past year, whether, as I mentioned, the acceleration of the COVID-19 vaccination process, whether it's getting new tests out. Remember, when the president took office, there were no at-home tests that were available to Americans. Today, we have several that are out there, and the president made millions of them available for free to Americans to get tested. We will continue to do that, working with you as best we can.
Thank you. I'm going to ask the indulgence of my colleagues. I want to just finish this up if I can. I'm just going to say, and ask, instead of asking a question about this, I think that there are serious consequences if we cut off support for low-income countries. I believe that is going to hurt us at home if we cannot stop COVID across the world. And one final comment to ask you about, Mr. Secretary, because we have put serious money into modernizing our public health data systems and to support the public health workforce. How does the budget request reflect the lessons that we have been taught about the importance of public health? How does it build on public health investments that we made in the omnibus?
I will thank all of you here because you made it possible for us to go to Americans rather than wait till Americans came to us to figure out how to attack COVID. We want to continue to do that, working closely with our partners locally and with our state governments. But we need to be able to have the resources to provide them something, whether it's the data. And by the way, on the data, as much as we need money, we also need authority. There are some states that do a great job of providing us data on where they stand.
That's interesting.
Some states don't. And it's tough when you've got these gaps. The more authority we have to collect this vital information, the better off every American will be in every state.
The authority thing is interesting, and I thank you. Again, I apologize to my colleagues for going over, and with that, Mr. Ranking Member, the floor is yours.
Madam Chair, you're the chair. You never have to apologize. You take the time you want. Just quickly, and I want to make a quick point, and then I want to talk mostly about, or ask questions mostly about ARPA-H. But remember on this COVID thing, honestly, our problem is a lot of stuff in the American Rescue Plan didn't have much to do with COVID. And we see that, at least from our side of the aisle, as the number one difficulty. There's a lot of money out there that can be redirected here, and that ought to be one of the options in front of Congress. But I certainly agree with you, Mr. Secretary. You need to have it sooner rather than later. And when we have the progress we've had, we need to keep the pedal on the metal, so to speak, and keep it up. I don't want to get behind the 8 ball here, but I also don't want to just say, it's okay to send money out willy-nilly to states. It was supposed to be for COVID, and it's not being used that way in many areas. Let me ask you about ARPA. And some of these questions, to be fair to you, you may not be able to ask right now or answer right now, and that's okay. I just want to lay these out and get some sense of what your initial thinking is and maybe where we're headed. Give you an example. I'm just going to fire off about 3 or 4 things here very quickly. Some of the things that would come to my mind would be, literally, where's the agency staff going to be physically located? What's the timeline for coming? Who's the director going to be? How will the researchers be recruited for ARPA-H? I know we don't want to cannibalize one agency for another. How do you envision the grants being made? All this is a problem, and I do not blame this on you or anybody else, but the authorizing committees didn't do their work. Now, this was the president's top priority. I agree with him on this, but normally that would be, other committees would have wrestled with that, but if we're going to continue to fund this, we're going to have to wrestle with this. And it's particularly going to be a challenge given the amount of additional resources you've asked for. I just tell you up front, from my standpoint, I'm not prepared to do that, even though I'm for the agency, when I have no earthly idea who the director is, where it's going to be located, how it's going to give out the grants, what it's going to do. I know what the NIH does and all those things. And I'm certainly not going to do it at the expense of literally lowering the National Cancer Institute's budget, things like that. So I don't disagree with the kind of spending you're talking about, but I do disagree with the division of labor between NIH and ARPA-H, which seems to me like it's going to have its hands full just getting up and running in the remainder of the fiscal year. So yield that back to you, Mr. Secretary.
Congressman, you've essentially asked the question that we're trying to formulate answers to ourselves. But I will tell you that we've gone pretty far along in announcing that we will have a director that is under my supervision versus NIH is director. What we're hoping to do is show that there will be autonomy. At the same time, because we want it, as you just said, to be able to get up and running, we don't want them to worry about who's going to run HR, human resources, instead of who's going to come up with the next innovation. We wanted to be able to pull on those assets, that infrastructure that's already in place. That's where NIH comes in handy. They don't have to do the administrative work. They don't have to do the human relations, the payroll work, the general counsel work by standing up all those different aspects of a new department or a new agency. What we're going to do is house it at NIH, but actually physically we're looking not to house it within NIH's own structures. We're going to have them separate. It's going to be a very lean, nimble team. It'll be far smaller than these agencies or the institutes you're accustomed to. There will be program managers, and including the director, him or herself, will likely not be in the job for more than just a number of years, 3 to 5 years, because we want to make sure that everyone knows there's a clock on what you're doing. Unlike NIH, which does that basic research, which could take a long, long time, and who knows when it'll be actually serviceable, what we're hoping out of ARPA is that these are ideas that we can harness right away. Again, very similar to what the Department of Defense did with DARPA, where, you know, the internet that we know today came out of DARPA, those kinds of things. That's what we want ARPA to do. But we need to make sure it's not anchored or tethered to doing things an older way. The program managers that'll be hired will know they're on a short time frame to get their work done, and then they move on. And we're gonna really have to lean on the private sector to be partners in this, because it's gonna be a lean team that really reaches out to folks who are out there doing it right now, and we're gonna do it with some support that you all give us.
Well, I don't have much time left, but I would ask that you keep us surprised as you make these decisions. I think we all have a tremendous interest in this and want it to succeed, but look at it with a little bit of skepticism until we see the structure and actually experience some success. So, you know, again, we communicate well back and forth. You've made a priority of that. I appreciate that. I would ask you to keep doing that, and as decisions are made, keep us informed, and hopefully, Madam Chair, we'll get to revisit this issue on in later hearings. With that, Madam Chair, I yield back.
Thank you very much. Congresswoman Roybal Allard.
Secretary Becerra, thank you so much for being with us today. For the nearly 3 decades I've been in Congress, one of my greatest frustrations has been the absence of a federal commitment to improve childbirth outcomes. As the husband of an OBGYN physician, I'm sure you are aware that the U.S. spends more per capita on childbirth than any industrialized nation, with costs estimated to be over $50 billion. Yet in spite of this investment, we have some of the worst maternal and infant outcomes in the developed world, including unacceptably high rates of maternal mortality and morbidity, infant mortality, stillbirth, preterm birth, and cesarean deliveries. To address these critical issues, in 2015, Congresswoman Jamie Herrera Butler and I formed the Congressional Caucus on Maternity Care. We, together with professional organizations and community activists, have worked hard to highlight the challenges of America's maternity care system and the need to make safe and effective maternity care a national priority for all women and babies. I extend to you a huge thank you for the $25 million in your HRSA budget to expand and diversify the midwifery workforce. This Title VIII funding line closely mirrors one of the 2 provisions in the Midwives for Moms bill that I co-lead with Congresswoman Herrera Butler, Catherine Clark, and Ashley Hinson. We all strongly believe midwives are a critical part of the solution to improving maternity outcomes, lowering costs, and addressing the maternity provider shortage. So I look forward to working with you to ensure that the final labor HHS bill will include this funding. Mr. Secretary, as you know, the FY22 Omnibus Agreement includes $1 million for the Office on Women's Health to convene an interagency coordinating committee on the promotion of optimal birth outcomes. This coordinating committee is intended to institutionalize the oversight and coordination of federal efforts to improve maternal and infant health in America. We believe this is the next logical step to build on recent federal efforts, such as the 2020 Surgeon General's Call to Action to Improve Maternal Health and the 2021 HHS Maternal Health Call to Action Summit. Mr. Secretary, when do you think the initial meeting of this committee will take place? And will you work with Congresswoman Herrera Butler and me to ensure the composition of this committee reflects the wide range of maternity care programs, issues, initiatives across the federal government?
Congresswoman, first, great to see you, and thank you for your deep interest in this area. As you mentioned, for me, it is also very important. I would tell you that probably over the coming few weeks, we probably can get back to you on how quickly we'll actually launch, with whom. We're right now trying to make sure that we have put all the correct experts on this committee. It is something that goes across many of the different agencies within HHS, so we want to make sure that we get those who are absolutely interested and committed to this and are the experts to be part of this. But we are more than committed to work with you and Congresswoman Herrera Butler in making sure that we address not just the outcomes issues that we face in America for women, but also the fact that we're now trying to take it to the next level.
Great, thank you. And how will the Office of Women's Health-led coordinating committee engage all of the relevant agencies to stay focused on concrete policies and actions to address the crises and challenges in the maternity care system? And how will you ensure this is an HHS priority?
By having the interagency committee, we are guaranteeing that we will have reports on a constant basis from all these experts from our different agencies within HHS. So we will make sure, and I will be participating as well. As you know, the president has made maternal health a major priority within his budget and his activities, because we understand that everyone should have a chance to start on the right track, and making sure that both mother and baby have that opportunity is critical. And we're going to make major investments, not just in this area. And by the way, midwifery is critical. The doula legislation that we've seen come out of Congress as well. All of us understand in a lot of our communities that promotoras are extremely important to help a lot of families navigate the healthcare system. We're going to make that a priority, and I personally will make that a priority.
And Mr. Secretary, in order to specifically address our nation's maternal mortality crises, the FY22 Omnibus also provided increased funding for the CDC's perinatal quality collaboratives that would allow for their expansion in all 50 states and territories. How can PQCs be empowered to address the avoidable harm of cesarean rates that have remained appallingly high at about one birthing person in 3 for more than a decade, despite professional guidance that this is too high?
Congressman, I know the time has expired, so I'll be quick and simply say we're going to do our part. We have, for example, put out a proposal under Medicaid that would allow a woman who's about to deliver have postpartum care after delivery, not just for 2 months under Medicaid, but for a full year. Now, all we need to do is get the states to buy into that, and about 5 states have. But we want to see every state go there, and the president would like to see that become a permanent program within Medicaid, where every woman who delivers a baby under Medicaid would have up to 12 months of postpartum care.
Thank you, Mr. Secretary, and I look forward to continuing to work with you.
Thank you.
Congressman Harris.
Thank you. And thank you, Mr. Secretary, for being here. It's great to be back in person.
Yes.
I think that's important for these hearings. First of all, just a few comments. I'm glad to see the Strategic National Stockpile funding, asked for $270 million additional above this year enacted. As I've said for many years, we have plenty of kinetic stockpiles. We better have stockpiles for some of the other threats we face, especially given what we know about the threats of biological and chemical weapons being used. Second, I want to echo the ranking member's comments about the riders that were left out of the president's budget. That's just completely unrealistic. I mean, these budgets will not pass. These appropriations bills will not pass through both chambers with those riders without those riders in place, and that's just a reality check. The third, I also want to comment on the ARPA-H. I have some concern because tethering it to the NIH administratively tethers it to the NIH academically and cerebrally. If we wanted to increase, the transitional research done at the NIH, we would do that. ARPA-H is supposed to be a different concept, and I think tethering it to a existing agency might muddy that concept. The last, my remaining time, I want to take up 2 issues where the department, I think, pretty clearly is not following either the law or congressional intent. First one is the surprise billing issue. This is something that I think we have, before the rule came out at the beginning of the year, we had some discussions with the department. We were assured that all stakeholders were taken into account, and then it appears that really only the insurance companies were taken into account. That the rule that came out found illegal by a federal court clearly showed that the congressional intent was not the rules that came out of the agency. So I hope that you're committed on the second go-around to actually doing what Congress intended, which is not to have the QPA as the basis of the of the arbitration, which is to carefully define QPA, not to allow insurance companies to define it in such ways that will further drive down the number of providers. And I will tell you, in a rural area, it's hard enough to find providers. You drive down reasonable compensation by the surprise billing rules, you will find great difficulty in finding those professionals to practice in those rural areas. I want to spend the last half of my time talking about an issue that we have spoken about before, because the last time you were in front of the subcommittee, I think we talked about the Conscience and Religious Freedom division of your agency, and whether or not you were going to commit the department to protecting conscience. Sad to say, despite your assurances to both House and Senate, in House and Senate testimony, it's clear that it's just not true, that urging the Department of Justice to dismiss the case against the University of Vermont shows that the department is not serious in protecting conscience. It's not serious in following the law. The Church Amendment is the law of the land. The purpose of the executive branch is to execute the law of the land. This was an egregious violation of 10 nurses' conscience rights in being forced to perform abortions in clear contradiction of the law established by Congress, and the department decided to drop the case, to urge the Department of Justice to drop the case, and with a commitment that I think that there, and I'll quote directly from your letter in reply, to continue to evaluate the underlying complaint. So in about 20 seconds, can you tell me how the department is continuing to evaluate the underlying University of Vermont complaint?
I'll do best I can.
Well, then I'll have to do it as a QFR. Okay. Because what I want to say is that in response to that, I filed the Conscience and Religious, the Conscience Protection Act, obviously, supported by the U.S. Catholic Conference of Bishops, because we think religious and conscience protection is a very important issue. I'm just going to ask, is the Conscience and Religious Freedom Division funded in this year's budget request?
Every aspect of the civil rights enforcement section will be
funded. So it is. So you're asking for funds, and then you're just using those funds to urge the Department of Justice to dismiss a blatant violation of the Church Amendment. Now, I want to just reflect that 75% of Americans believe that healthcare providers should not be legally required to perform abortions. And I will tell you, in an age, I'm worried not only about abortions, but in an age where a Supreme Court justice potentially doesn't know the definition of the word woman, and healthcare providers are going to be asked to perform gender mutilation surgery because some people's religious, according to some people's conscience, that's what it is. And by the way, if you have any question about what a woman is, I know you're not a biologist either, give me a call. I'll tell you. It's not that complicated. I am greatly concerned about conscience protection, and I question why we're funding a Conscience and Religious Freedom Division in a department that is willing to use that against the conscience protection of Americans, as the University of Vermont lawsuit, dropping that lawsuit, showed. I yield back.
Ms. Lee.
Good morning, Mr. Secretary. I'd like to respond to Dr. Harris, but I won't. Glad to see you. Thank you, Congresswoman Frankel. First of all, thank you for your tremendous leadership, and thank you for ensuring that health equity is an important cornerstone in all of our HHS efforts. With the support of our chairwoman, Congresswoman Presley, Senator Warren, in the FY22 Omnibus, we included language directing HHS to submit a report that involves a detailed plan and proposal for the development of a national center on anti-racism and health equity within the department. And so following up on that, I'd like to know the steps that your agency will be taking to comply with this, this requirement for its development. And secondly, just with regard to HIV and AIDS, I'm really encouraged to see that the president's budget requested $377 million increase for ending the HIV epidemic initiative and $9.8 billion over the next 10 years for a PrEP delivery program to end the HIV epidemic in the United States. So just wanted to know how you envision this program being implemented. Next, the announcement of the new HHS Task Force on Reproductive Health, the announcement, how will that be implemented? What steps are being taken? And finally, just on poverty, Congresswoman, Chairwoman Lucille Roybal Allard and myself, well, we put into the FY 2022 appropriations bill directing the Secretary, yourself, to convene an interagency coordinating council on both child poverty and comprehensive supports. So I'd like to know, in terms of your views on the development of the implementation of this congressional directive with regard to children and the Interagency Council.
Congressman, great to see you, and thank you for all the work you've been doing. Let me try to give you a bit of an answer, and please probe if you'd like to on any of those subjects. First, the National Center, for us, that's a priority because we know that bad health outcomes often occur not because of just your health, but because of the social determinants around you. And so we intend to move on that as quickly as we can. We will keep you apprised. We have a team that's working on that, but that was one that you had us at hello in trying to do that one. On, if you could tick off the,
HIV and AIDS in terms of the HHS implementing the program to end the AIDS epidemic by 2030.
I think you'd agree we're that close to actually finding a cure, not just keeping people alive, but actually finding a cure on AIDS, HIV, and we should go the rest of the way. And so you see the President's commitment to try to get us the rest of the way. We intend to try to fully implement that. We have teams at HHS that have been researching this, that have been implementing, that have been guiding America for a long time. They are anxious to be able to get the resources to let
Great.
let
And I have a few more questions.
Sure.
If I may get them to you in writing under this issue, but on the next two questions, in terms of the announcement of the HHS Task Force on Reproductive Health Care, which was announced, how that's going and being implemented, and finally, the Children's Interagency Council as it relates to poverty and comprehensive supports.
Again, that council, we are in the process of setting that up as well. We know we have a lot of work to do because we see how throughout the country reproductive health care rights of women are being not only enjoined but probably undermined. And so we want to make sure that we're out there trying to make sure that we're protecting their rights under the law and making sure that their health is maintained. And so we will aggressively move on that. We will work with those who are interested, including those in Congress, but we do intend to move on that one as quickly as we can.
Okay, thank you. And the final question I had was the implementation of the Children's Interagency Council that Congresswoman Lucille Roybal Allard and myself are working on.
The same there. We were given that charge recently, and so we are moving forward to try to make sure that we put in place the infrastructure to make it happen. Again, I think this is one of those where we have, whether it's at the Administration for Children and Families or any of our other agencies, HRSA and all those who would have a role in that, we're anxious to get going. We will keep you apprised and see who's interested in working with us on that.
Great. One more follow-up. I have a minute and 20 seconds left. Going back to HIV and AIDS. Okay, the PrEP program, in terms of providing PrEP medication at no cost to people who really need PrEP and don't have the resources, and wanted to find out how does coverage of PrEP at no cost under Medicaid fit into the administration's overall goal for PrEP?
So I know that what I can tell you right now is that we are doing everything we can to do bulk purchases because we know for a lot of folks it's unaffordable. We do bulk purchases, we can get those treatments for far less cost. We can then make it more available to more Americans. We also are trying to make sure we focus on those who are usually left behind when it comes to these types of therapies and treatments, and we're making sure that we reach to them. I would have to get back to you on how we would handle this within Medicaid because you know that is not a simple process of just turning the switch.
Okay, look forward to hearing from you. Okay, and finally, let me just associate myself with what the chairwoman mentioned and said with regard to our global COVID efforts, and in fact, remind everyone that we've got to have the resources for the global COVID response. There are new variants on the rise, and I just want to remind everyone that this is a very small planet. What affects one affects all. It's in our own interest to fund both domestic and global immediately. Thank you again.
We concur.
Mr. Fleischman.
Thank you, Madam Chair. Ms. Secretary, good to see you this morning, sir.
See you.
Mr. Secretary, I have a couple of very important questions, so in all respect, I'm going to ask for the most brief response in light of the time. One of the things that concerns me the most is the administration has announced plans to lift Title 42 within the next 2 months. That greatly concerns me, not only in my role as the ranking member on Homeland Appropriations, but this is going to allow tens of thousands of illegal crossings daily on our southern border. Do you support the change in this policy, and are you concerned with the strain it will place on our healthcare system and local hospitals, which are still struggling amid the recovery of the COVID-19 pandemic, sir?
Congressman, appreciate the question. Let me try to get right to it. A lot of folks probably don't know what Title 42 is, but it is a law that allows us, based on public health conditions, to impose certain conditions within the country, one of those being at the border. Title 42 is based on healthcare conditions, and we use Title 42 to make sure we're protecting Americans within our country, within our borders. Title 42 will remain in place so long as the folks at the CDC and others, the scientists, give us the facts and the science to show that in order to protect public health, we can and will use Title 42 to protect Americans. And so what I can tell you is that we constantly do an analysis of where we are. We'll make a determination at some point as to whether or not Title 42 should remain in place.
Okay, so in addition to the national security concerns that I would have in regard to that and the border crossings, you would understand the implications this would have for the burden on the current healthcare system.
I recognize everything you said. You just have to remember Title 42 is based on healthcare.
Yes, sir. Okay, thank you, sir. Medicare wage index. Over the past decade, well over 100 hospitals have closed. And over the past 2 years, COVID-19 has made healthcare access and this crisis significantly worse. It is no coincidence that most of these hospitals have occurred in areas with the lowest Medicare wage index rates. Now, I know you have inherited this, the administration has from administrations past. It's a big problem in my state of Tennessee. Do you support, sir, a permanent legislative solution to address the problems in the Medicare area wage system and prevent future hospital closures, sir?
Big question, Congressman, but I absolutely understand the gist of it. What I will tell you, and I'll try to be brief because I know you probably have other questions, we need to tackle this because we've seen so many of our healthcare workforce leave, and we need to make sure that they're in place, not just for COVID and any pandemic, just that we have to make sure we have a healthcare system that doesn't have gaps. And so I will tell you that whether it's Medicare, Medicaid, whether it's CHIP, whether it's the Affordable Care Act, we have to make sure that we're promoting Americans going into our public health workforce.
So then the answer was, my question is, do you support a permanent legislative solution to this?
Show me the legislative solution, and I'll tell you if I support it.
Fair enough. Since national minimums for reimbursement formulas seem to be working for the Medicaid program and the Children's Health Insurance Program, do you agree, sir, that a national minimum for the Medicare wage index system is needed?
Again, you point to a very important program in Medicaid. Devil's in the detail, Congressman. I'd love to work with you on this, but the devil's in the detail. We have to make it work, not just for us, not just for patients, but for taxpayers.
Yes, sir. And for the record, so that you know, particularly in my home state of Tennessee, the respectfully insufficient reimbursements in this are causing undue pressure, particularly on rural hospitals at a time when they're really struggling. We've seen many closures. So in that regard, I would ask that you and the administration work with us to cure this. Again, this was a patchwork system from the inception, created years and years ago. It was politicized. It was and if you will, it awards or rewards inefficiencies many times to raise these indexes in other areas of the country where fiscal restraints and good policies tend to get punished for their fiscal responsibility, and that's what we see in our state, sir.
Congressman, what you've said I've heard before.
Yes, sir. Thank you. Madam Chair, I yield back.
Thank you.
Mr. Pocan.
Thank you very much, Madam Chair and Ranking Member Cole. Appreciate it. And Secretary, thank you so much for being here. Just this month, we celebrated the 12th anniversary of the Affordable Care Act, and I just wanted to quickly congratulate you on that anniversary, because I know you were an instrumental part of those bills, making sure they got signed into law, and even as the California Attorney General in defending those laws. A key piece of the Affordable Care Act was its protections from discrimination for the LGBTQ plus community seeking health care. Can you talk a little bit about how your team at HHS is continuing to build on these protections and further expanding care for this community? And a related question, if I can, as you know, across the country, many states are passing laws that harm youth, especially transgender youth. I want to thank you for your commitment to these kids and ensuring that they receive the health care they need. What kind of outreach and support is HHS providing to stakeholders in states where these attacks on LGBTQ plus youth are taking place?
Congressman, appreciate the question, and it sort of goes to the question that Congressman Harris asked earlier. I believe you're referencing Section 1557 of the Affordable Care Act law, where it provides for protections for Americans against any type of discrimination in the healthcare setting. We are going to do everything we can to make sure we are protecting people's rights that they have under law, under the Constitution, whether it is the right of an LGBTQ person or whether it's someone who is claiming that there has been a violation of their religious freedom. We will do everything we can within our Office of Civil Rights to protect those rights of Americans. We know that there are a number of individuals and families that are under attack these days on LGBTQ basis. We are out there trying to inform people of their rights. We're trying to make sure providers know of their legal obligations, and we are ready to step in if someone comes forward with a legitimate complaint demonstrating facts of violation of the law. We'll jump on it.
Great. No, I appreciate that. Thank you. Also, one thing I think that's really been highlighted through COVID is our nation's mental health. In one area specifically, there was a congressional initiative around the National Suicide Designation Act, which is going to designate the 988 number, emergency number, to be rolled out this summer. Can you talk a little bit how your agency is looking at educating the public on that, and how this budget will provide funding to have a broad campaign so public can understand this? And again, a related question, in my state of Wisconsin, I think 89% of the calls are going from local crisis centers, about 11% get routed to the national. Just how that support and the importance of those local crisis centers fits into this.
So, Congressman, as you're probably aware, suicide is the leading cause of death of young Americans and young adults in this country. We're in a crisis. COVID exposed just how much mental stress so many of our families are going through. I believe half of American parents report that their children are thinking of suicide. It is a crisis, and fortunately the president has not only decided that it's a priority, but he's putting money behind it as well in his budget. We have invested over $300 million in trying to help states help us patch together what is the existing set of suicide prevention centers that are available throughout the country. We finally, through your good work in Congress, we now have the ability to talk about suicide prevention by something akin to what we think of in terms of an emergency response. Everyone knows 911. If you're in an emergency, you call 911. Well, if you're facing a mental health emergency, now you'll get to call 988. And if you call 988, we want to make sure you've got not just a supportive hand, but a professional hand ready to assist you. And so what we're doing is we're working with states throughout the country to make sure everyone's ready. This will not be a national federal government-run hotline. It will be brought together by the federal government with the president's support for this. And what we're hoping to do is make sure that if you call 988, you don't find a busy signal or you don't get put on hold, that you will actually get assistance, because you're reaching out at a time when you could have gone the other direction and just said, I'm just going to end this thing. We want to make sure that when you reach out, we're there.
Yeah, very important initiative. I don't think in 16 seconds I can ask another question fairly, so I'll submit those. Madam Chair, I'll yield back. Thank you, Mr. Secretary.
Thank you.
Thank you. Ms. Herrera Butler.
Thank you, Mr. Secretary, for being here. And I wanted to bring up just a quick follow-up on my colleague's question about Title 42 and rescinding that authority. And you made the point that it is a health-related decision. And I agree with you, which is one of the reasons I would ask you to help us get the administration to reconsider. You could do a quick Google search of the just drugs flowing in from Mexico. And fentanyl, which is a huge problem in Washington State and across this country, certainly on the West Coast. Every major newspaper has stories on how this drug, which is is killing people, and methamphetamine are flowing over that border. And we can almost tell. I've met with my local law enforcement in the middle. I am I-5, Canada to Mexico. I-5. They can tell within a week of a surge, drug prices for fentanyl drop to $3 a pill. And we see increases in overdose deaths and hospitalizations. So I would argue that it is, in fact, a health crisis as well, which would give you the reason to use that Title 42 authority to gain some more control over the border. So I just wanted to put that in your wheelhouse. And let me start by saying, Congresswoman Lucille Roy Ballard made several really good points about, our efforts on infant care and maternity care. And you know that the numbers for the developed world, the U.S. is not where we should be on both of these fronts. So I do want to say I'm very grateful that you are working to implement an extension of Medicaid for women during that first, year of life. We know that most of the mortality incidences that happen within that first year, not within the first couple of weeks or 6 weeks of giving birth, but most of them happen after that. So making sure that Medicaid coverage extends to that first year of life of the baby and the mother to treat that is incredibly important. We have legislation to that effect, but I'm glad to see that the administration is moving forward with that. On the FY22 omnibus package, Lucille and I were able to secure $750,000 for the first ever stillbirth task force at HHS. More than 22,000 babies are stillborn every year in the United States, one of the worst stillbirth rates in the developed world. Where is HHS in the process of setting up that task force, and how can we utilize existing programs like the Safe Motherhood Initiative to optimize the work of this task force?
Congresswoman, first, thank you for all the work that you and Congresswoman Roy Ballard have been doing on these subjects. Small investments, big change. And we're going to work with you on that. Thank you for making it possible. We're going to get to work as quickly as we can on some of these things. I can't tell you how many stories my wife has told me about stillbirths as an OBGYN. That's as devastating as it gets. And so we will do everything we can. We will include you, and we're going to try to make sure everyone understands that we have an opportunity now to really shine a light on this and focus a bit more.
Great, thank you. Switching a little bit to telehealth, one of the silver linings, I think, if there is that of the pandemic, was that we recognized that we can do telehealth and do it well. The biggest challenge, and for those of us in more rural areas, it has been a godsend. The biggest challenge I've heard is it's been great that CMS, there were waivers in place to pay for it. Will those be extended? And I know that there's a little bit, it's not totally within your purview, but I'd like to hear you for a moment just share what your intentions are with regard to trying to help us make that more permanent.
Well, first, I have to thank you all for giving us the extension of another 5 months of the authorities on telehealth under this public health emergency. We need more help because we only have certain authorities to continue some of the telehealth activities that we've engaged with. And we're hearing from all sorts of providers and families about what happens if they can't use telehealth. So we're going to do what we can. We're going to stretch our authority as much as we can under law, but we do need Congress's help because the statutes constrain how much we can use telehealth. So please help us with that. Thank you for the 5-month extension.
In my area, it's switching to workforce shortages, and very quickly, obviously, we don't have enough of anything. Right? We don't have enough RNs. We don't have what we need. Again, this is another piece where telehealth can help. But your budget proposes a $2.1 billion increase in the HRSA workforce programs. How can we ensure that we're focusing on the entire workforce pipeline? And how can we do this in the most expeditious manner possible?
Well, we have specifically targeted rural health as well as some of the underserved areas. For a quick example, on telehealth, you could have someone who wants to do telehealth as a provider, as a doctor, but if you don't have good broadband, there's a really strong chance you're still not going to be able to take advantage of that. So the investments in broadband that now have been made available, the fact that we're trying to figure out how we allow that service to cross state lines as well, because there are different standards in different states for those medical professionals. But we, not to let the old way of doing business get in the way, we're going to try to do all of that. But that's where we'll need your help to give us the authorities to go beyond what we've done before.
Oh, thank you. Thanks. I yield back, Madam Chair.
Congresswoman Clark.
Thank you, Chairwoman, and it is so wonderful to be with you, Secretary Becerra. And I want to thank you for this budget that puts the American family first and is concerned about their health and their security. And it is a great piece of work. Specifically, I want to ask you about childcare. We know we're not going to have an economic recovery. We're certainly not going to have one that includes women unless we make investments in childcare. And I'm grateful for this administration's help with the American Rescue Plan, the $40 billion we were able to secure to stabilize childcare. And we know we have to go further, and this budget does that. But I specifically want to ask you about the workforce issues. Childcare providers are overwhelmingly women and women of color. They make an average of $12 an hour caring for our children, leaving too many of them in a position they can't care for their own, and they've lost 1 out of 9 jobs in this sector. So specifically, how is this budget investing in that workforce? Are there other things Congress can do to help prioritize? And in addition, just yesterday, I was with a healthcare leader from my district who was telling me about how linked in his hospital the nursing shortage and a shortage of childcare is. And I specifically want to know if the $324 million for the health workforce programs address the caregiving needs of our healthcare professionals.
Well, Congresswoman, first here I have to thank those of you who supported the American Rescue Plan, because it made available to us billions of dollars to help a lot of those child care workforce participants, but also the families. We know that if we are able to get the child care proposals in the Build Back Better agenda, that we would have the ability to actually meaningfully tackle this, not just try to put a Band-Aid over it. It is tremendously important for the tens of millions of families who need child care. We saw women lose jobs in numbers never seen before because of COVID and the need to be home to care for kids, not being able to have a child go to school. And so I don't think there's any question that we have to make major investments in child care, Head Start. The proposals that have been put forward would help us go there. The president's budget makes additional investments into child care, but to really take this where we've got to go to the next plateau. We hope that Congress is able to get across the finish line the child care proposal that is in the president's Build Back Better agenda.
Thank you. Next, I am also grateful for your leadership in releasing through the ARP and the F-21 omnibus LIHEAP increases, a lifeline for families in Massachusetts and across this country. But we know that due to Putin's war, the pandemic, corporate greed, prices are still going to continue to soar and be out of reach for way too many families. There is an increase of $175 million, and I just want to know how you're preparing for increased volatility in this line item, and are you working with Department of Energy to anticipate the best you can?
We're hoping to work not just with the Department of Energy, but with the Department of Education, with the Housing and Urban Development Department, so that we can coordinate our activities so that if there is a family in need, it might be energy, help with energy bills, it might be help with staying housed and not lose your home. Whatever it is, we're going to try to make sure that we're working together to make sure that we're tackling this. No doubt that the dollars that you provided previously and the dollars the President's requesting for LIHEAP will take us a ways, and the more we're able to see success in this effort to keep the leadership in Russia from this crazy war in Ukraine will help us. But we're going to meet every need we can with the dollars that you've given us, because we know it could be the difference between life and death for someone who needs that heat or someone who has to stay away from the horrid temperatures in the summer.
And briefly, at the end of my time here, we know that overdose deaths have increased by 30%, and that in not the area we want equality. Now, Black deaths of opioid overdose, due to opioid overdose, are exceeding those of white people. And so I just am urging, there is a program that we helped create and I led on that helps link student loan repayment to encourage and retain people in substance use providers. You have increased that account by $4 million. We are very grateful to your attention to this program. But we also know that only 8% of those 3,000 applicants to this STAR LRP program last year were able to be funded. So we hope we can continue to work with you to meet this need so we can get people the treatment they need and deserve and reduce these terrible rates of deaths and overdose.
We want to give you wind underneath those wings to make that happen, because getting those professionals out there is absolutely important.
Thank you so much. Thank you, Madam Chairwoman.
Mr. Molinar.
Thank you, Madam Chair. Good morning, Mr. Secretary, and thank you for your service to our country. One of your, within your statutory authority as Secretary is not only to declare a public health emergency, but also to terminate that decision. One of the questions I have is, when do you plan to declare an end to this public health emergency? What scientific metrics will you use? Is there a specific rate of transmission? How will you make that decision?
And Congressman, I think there are a whole bunch of folks waiting to hear this answer, so great question. It will be based on the science and the facts that we're collecting. And by the way, that goes back to the question about data, why it's so important to collect data accurately so we make the right decisions. It will be based on the science, on the conditions we have in the health sector. There are a number of issues that that are obviously floating around there, but in terms of the health of the nation, where are we? And are we at a point of still an emergency? We're in the process over the next couple of weeks of getting ready to review again if we should continue the public health emergency forward. We've also made a commitment, because we know providers are counting on this, whether it's on the telehealth issues, to continue to have authorities to use telehealth or not. A lot of providers are relying on our extended authorities to do things. And so we've committed to try to give people at least 60 days notice if we think we're going to take down that emergency declaration.
Okay.
What I can tell you is, in the next couple of weeks when we review it, we will assess the facts, science, and make a determination. But we do hope to be able to give people at least 60-day notice.
Okay, thank you. And then with respect to the mandate, CMS has a mandate on vaccines.
Yes.
You'd mentioned the workforce issues. Are you aware that people are leaving as healthcare workers because of this mandate? And shouldn't we be allowing the medical professionals to make that decision on how best to protect themselves and their patients?
I think we always want to work with and respect what the experts in the medical field are telling us we should try to do. We do follow the experts that we have at CDC, NIH, FDA, and what they've told us is that keeping people safe, especially in a medical setting like a hospital or nursing home, requires us to use every precaution we can, whether it is a vaccine, whether it is a mask, whether it is the social distancing or the sanitary conditions. And so when it comes to the provisions that we put out there, in some cases requiring folks to use masks, requiring them to get vaccinated, it's for the protection of the American people.
But are you aware that's actually creating workforce issues where we're losing healthcare workers, the people who have been on the front lines, heroes, who are deciding to leave rather than submit to this mandate?
Congressman, I've heard some of those stories. I would simply say, if you're one of those heroes, one of the ways you become a hero is by making sure the people you're treating are as safe as they can be. And if you're not vaccinated and by chance you contract it, even if you show no signs of the illness, you might pass it on to somebody.
But that's true even if you are vaccinated, correct?
Less likely to happen if you're vaccinated, far more likely to happen if you're not.
Do you, I recognize your commitment to vaccines, vaccination. One of the concerns that's been raised is about the level of commitment to therapeutics and making those available, approving as, many safe possible therapeutics. Are you committed to that?
Absolutely, but can I give you a bit of an extended answer? Right now, a vaccine likely costs us about $25 to $30 to make available to Americans. Those antivirals, among those therapeutics, probably cost us somewhere between $500 to $750 to $1,000 of a treatment. Those monoclonal antibodies are costing us in the several $1,000s a piece. $30 versus several $100s or versus several $1,000s to one might keep an American from contracting COVID. The others are trying to keep them from dying from COVID. We'd rather do the, penny, as we say in Spanish, mejor prevenir que remediar, better to prevent than to remediate. We spend $30 to prevent it rather than pay later. Pay now $30 and pay later hundreds or thousands of dollars per American. We think it's a smart investment, but we're going to have the therapeutics available, and that's why we need some funding from Congress.
Just so I know, the president recently received a booster on television. How often is he going to need a booster? How often are you going to recommend that for the American people?
That's up to the scientists and the medical professionals. But just as we get vaccinated for flu on a constant basis, what we're finding is that COVID is a treacherous animal, and it's hard to control. We'll do what we can to keep Americans safe, and we'll make sure that if we give them a medicine or a vaccine or therapy, it'll also be safe.
Thank you.
Thank you.
I yield back, Madam Chair.
Ms. Frankel.
Thank you, Madam Chair. First, I want to just thank all my colleagues for the bipartisan approach in getting the budget done. With that said, I want to just say this, that compromise does not only always mean agreement, in my opinion, without any personal disrespect to any member. The Hyde Amendment is not wise. I think it's unjust and cruel. And I believe it takes away the freedom from people to make the most personal decisions that they can have. And it hurts the people who have the least amount of resources. Let me just add that no patient should be denied the care they need, and I appreciate the administration's position on that. So let me just add my thanks to your proposed budget, the funding for increased funding for Title X, child care, that's reproductive care, child care, maternal health, mental health. And I think it's very important that we are, not only are we helping people take care of themselves, but we're reducing the costs for people so they can take care of themselves. And I'd like to just say that I think the best defense for this country is to have a strong economy and have people live well. I have a couple of questions. Thanks to and thank you for being here. Yeah, thanks to the Affordable Care Act, there's the contraceptive coverage requirement really allowed millions of people across the country to really to afford contraception. But we have been hearing lots of stories that health insurance companies are not complying with the law. So, for example, they pick a couple of products that a consumer can use, a patient can use, and not others, or they're actually requiring payment, some cost sharing. I wanted to know what the department is doing to ensure that every plan subject to the ACA's birth control coverage requirement is complying with the law.
Congressman, thank you for the question. I have experience with this not only as the secretary, but as the former Attorney General in California, where we moved to make sure that women's rights to contraception coverage were protected. As the secretary, we've been working jointly with the Department of Treasury as well as the Department of Labor to make sure that there's clear guidance to providers on what they are obligated to do when it comes to providing healthcare services to Americans. We will continue to make the case that under the ACA, individuals, including women, are entitled to certain protections and services, including contraception coverage. And if someone points out to us a case where there is a provider that is violating the law, we're prepared to take action as well.
Thank you for that. And here's an issue that I hope Mr. Cole's going to join me in vigorously tackling. He's smiling. He knows what I'm going to talk about. Each year, there are about 36 million falls reported among older adults, and it's amazing what it costs our health system. And not only costs the individuals themselves, and just not in terms of their physical, mental health, and their pocketbook, but it costs us over $38 billion for Medicaid and Medicare, and then another $12 million just in private insurance costs or out-of-pocket costs. I was astonished in researching this that the federal government only invests a few million, CDC $2 million, I think it is, in fall prevention programs. I want to thank our chair lady, because I know we're going to have a hearing on this. I was just wondering whether you all are doing any work to look at this.
So we right now have our National Institute on Aging, the CDC, which you mentioned, as well as our Administration for Community Living. Those three agencies within HHS have been working on these issues. We work with the states and the local health authorities there to figure out how we can invest in some of these activities. But Congressman, as you know, at the federal level, we don't usually try to figure out which program is best and give the money to that program. We work with the states to let them decide locally which are their best programs. We try to support, make investments in those programs. And we have done some of the research. We try to provide that to the states. And then working together, we hope that with the resources that you made available to us, that we make available to them, that they'll make investments in those types of activities.
All right, well, I look forward to further discussion on that. And Madam Chair, I yield back.
Mr. Klein.
Thank you, Madam Chair. Thank you, Mr. Secretary, for joining us. It's good to have you with us. It's good to be in this room in person, and I'm pleased to be a new member of the committee in this room. But you talked about facts and science guiding your decisions when it comes to Title 42, for example, which I would advise we should not repeal. I think it's a policy that is necessary to protect the public health, and I would urge you to continue to enforce it. But I want to talk about a different sub-agency that you have, the CDC, and allowing politics to override policy and science. A report of the Select Subcommittee on the Coronavirus Crisis revealed that the CDC allowed the American Federation of Teachers to rewrite critical portions of the Biden administration's school reopening guidance. The CDC initially planned to issue guidance that would have been more favorable toward opening schools, but reversed course after consulting with teachers' union bosses, giving favorable treatment and access to teachers' unions instead of parents, and ignoring science and the necessity of opening our schools. And we see what that resulted in, not just lower test scores for our children, but also increases in depression rates, increases in suicide rates, increases in drug and alcohol addiction rates, increases in domestic violence in the home. So let me ask you first, Mr. Secretary, were you in contact with the American Federation of Teachers about these guidelines?
So, Congressman, I'd love to probe
Yes or
some
no
of what
would
you
be
said, but I have not been in direct touch with any particular stakeholder just on those guidelines itself. We have done numerous stakeholder meetings with all sorts of organizations, individuals, governments on the issues, because that's what we always do, is whether CDC or us, we always consult with everyone that might be impacted. So along the way in formulating any proposal, we speak to anyone who might be impacted.
So the answer is yes to that.
I didn't say that was the answer. I said we speak to if you want to characterize it properly, Congressman, and having been in your seat before,
I would love a yes or no answer to
that. Misquoted. We have sat down with every stakeholder who has asked us on those particular issues.
Okay. And that includes the AFT.
I'm pretty sure it has.
Okay. Is it department policy to keep draft guidance confidential?
Draft guidance is within the internal operations of the department.
Right, and historically, in the CDC, draft guidance has been kept confidential, correct?
Well, it's an internal document. It's not something for public consumption because it's not yet ready for prime time.
Right, so sharing it, as testified to by the director of the CDC for the Select Coronavirus Crisis Task Force, they testified that it was unusual to release that guidance to an outside group.
I'm not sure I would characterize what happened as you have, but what I will tell you is in consulting and meeting with stakeholders, we certainly give them some sense of what we're looking at and ask for their guidance. How much actually translated into what you've described, that's where I think the facts have to answer that question.
Are you aware of other cases in which the CDC or any other agencies under HHS have incorporated language from outside stakeholders?
We certainly, as I said, we offer every stakeholder an opportunity to comment, whether it's a formal rule that we're getting ready to promulgate or whether we're looking to have a guidance. We always reach out, every administration has, at least I hope they have, to have those who might be impacted to get their input. Might their input help us shape the final version of that guidance or rule? I would hope so, because we're supposed to listen to the American people.
Okay. Moving forward, would you commit to citing those outside partners who may have been consulted in the development of these guidelines?
Congressman, that's all public record.
When you are developing these guidelines, you just told me that it's policy to keep draft guidance confidential.
Oh, the draft guidelines, anything that's still internal is internal, but when we reach out to stakeholders, that's publicly available.
Are you committed to listing those stakeholders?
Again, as I said, it's already publicly available. Those meetings are in the public domain.
And citing them in the development of these types of official guidelines?
If you take a look at regulations when they're issued, they will note the comments that have been received, and we usually have to try to be responsive to most of the comments that we receive as we're getting ready, for example, to promulgate a rule. So again, that information that comes in from the public, when we react to it, you'll see it in
Well, you didn't cite AFT when you put out those guidelines for school reopening. So I'd encourage you to be more forthcoming.
You've reached a lot farther along than what I'm saying we've done.
You're talking about regulations. I'm talking about guidelines where you neglected to disclose that the AFT edited the guidelines on the orders of the White House and put them forward as CDC guidelines and neglected to release the fact that the AFT altered those guidelines. And I'm asking you if you would commit to publicizing the fact that you allow politics to override science when it comes to your guidelines.
Congressman, it'd be tough for me to respond to that because I don't agree with the premise that you've just laid out.
Well, I don't agree with what your CDC did in promulgating those guidelines. Children died because of that. I yield back.
Ms. Watson-Coleman.
Thank you, Chairman. Secretary Becerra, it is so good to see you. It is so good to hear the good things that are happening. And let me also echo that I think our budget is moving, your budget requests are moving in the right direction, even though I'd like to see some more things in some places. From a general perspective, I'm very interested in all of those issues, from mental health to suicide to maternal health. I am particularly concerned how all of those issues impact Black women and the Black community and Black children, because as we all know, unfortunately in this country, we represent the bottom of the heap when it comes to the direness of all of these issues. So I'm going to ask you some questions about that. But before I do, I want to ask you about something that's very disturbing to me. Recently, the CMS drafted and made a decision impacting the access to Alzheimer's disease medication.
And this decision is delaying the availability of that medicine, even though the FDA had already taken it through its procedures and had deemed it ready to be more available. And so I'm wondering, is there some miscommunication? Is there some new authority that CMS has? Does this represent a redundancy? Are you all aware of it? And do you have a thought about addressing this issue? Because Alzheimer's disease is something that's just so devastating to our various communities, and the sooner we can get a handle on it, the better.
Congresswoman, first, I couldn't agree with you more. I think all of us believe that in the near future, we will probably see medicines and therapies that will help us tackle some of these just devastating conditions and diseases like Alzheimer's. And we want to be there. I think all of us would like to make sure we're there as quickly as we can. And for that, we have to make sure we've got the science coming along with us, because we want to make sure that we're telling people we're giving them a treatment, a medicine that will help either cure them or stabilize them and not harm them. And so remember that FDA has to operate and does operate under a different set of rules than does CMS. FDA has to tell us if they think there's a treatment out there that might be safe and effective and under what conditions. And FDA gives a conditional approval to Aduhelm to provide some treatment for some individuals who might be on the stages of, into the early stages of Alzheimer's. CMS has to make a very different determination whether or not, now that FDA has moved on a conditional basis, that all the 65 or so million Americans who receive Medicare services would qualify to receive Aduhelm and have it reimbursed, or have their doctors and providers get reimbursed for having provided. Two very different things, two very different analyses. One had, FDA has, I'm sorry.
Can I interrupt you because I have so many other questions?
Yes.
It seems to me that the FDA is relying on, that we rely upon the FDA on the science, on the efficacy of the therapy or the medication, and CMS makes a determination as to whether or not it should be covered. The latter is important, but the former is the determination in my mind as to whether or not that medication should be available. My understanding, this is an unusual step for CMS to get into after FDA, and I'd like to have more information on that. I did send you a letter on that. I'm looking forward to a response on that. And maybe we can't answer it at all today, but I get it that they're in two lanes, but it looks like there's an unnecessary crossover from CMS into a lane that isn't theirs to be in the first place. But moving on, I'm concerned about an issue that we've all been touching upon. We know what's happening with mental health issues in all of our communities. I'm particularly concerned about mental health and suicide and those things that affect Black youth, Black women, Black men, other sort of underserved communities. I'm interested in 988 being made publicly available and diverse in who answers that phone, who has the capacity to answer those questions, and making sure that everyone, and I want to know what you all are doing to make sure that there's wide knowledge of it and diversity in it. And I also want to know one last thing, and that is that we really have experienced an amazing impact on children and adults through this pandemic. One thing that I see that I think we need to give greater attention to is the children who've lost their protector, the person who has taken charge of them, who's cared for them, who's paved the way for them as a result of this COVID. And I think that we need to be looking at what are the long-term needs and how do we pay for those long-term needs so that those children have adequate mental health support as well as any other support that they need. I see that all the red lights are 000, which means that I'm out of time. But I've given you a kind of a flavor of where I am and where my concerns are, and I certainly will follow up with some additional questions to you in writing. Thank you so much.
Congresswoman, you'd never
I
stop
yield
letting me
back.
know where you are, so that's good.
Congresswoman Lawrence.
Hello, thank you so much for being here. So good to see you. I've called you a lot of things, colleague, and now I call you my secretary. I want to thank you for commend the department for more than $250 million, including $8 million to Michigan's Department of Health and Human Services to expand and restore access to affordable Title X family planning. I just want to thank you for that. As previously noted, the COVID-19 pandemic has undoubtedly had an impact on the mental health of our children across this country. I have a unique and passion for protecting foster youth, which they're no different. Earlier this year, I led a bipartisan, bicameral group of my colleagues urging your department to determine what resources states and territories need to ensure that every child can have access to timely mental health services in foster care. And we know that the CFSR provide an opportunity to review state child welfare systems. This includes assisting the states by ensuring children and families achieve positive outcomes. However, in order to fully understand the work, we need an updated data to reflect the number of mental health screenings and the frequency in which they are conducted. So, Secretary, today I'm asking if you would commit to reviewing my letter from me and my colleagues, and that the critical information in forthcoming CFSRs.
Congresswoman, first, thank you for your devotion to this issue. We are going to make a special emphasis within the department on foster care. Because of the resources you all have made available, we can actually try to take states to the next level, because we know that they're behind on their assessments.
Yes.
They haven't been providing the right data. We've talked about how valuable data can be. Bad inputs produces bad outputs. And so we're going to try to do as much as we can. If you get to the point of getting this bill back better, I will tell you that we will have an opportunity to do far more. But we're going to do what we can, because we know in the foster care system, we're seeing too many of our young people age out and then really be in trouble. And so we would love to work with you further on this, and thank you for that letter.
Thank you so much. Also, the pandemic has worsened Americans' maternal mortality crisis. I'm encouraged that the president's budget is reflective of putting resources into it. Last year, I introduced the Doula for VA Act to create a pilot program with the Department of Veterans Affairs, providing veterans the access to doulas, which they have been denied. So, Secretary, can you explain to me how the president's budget will grow and diversify the doula workforce, as well as other proposed maternal health pilot programs?
And Congressman, thank you for the question. As you've heard in some of the previous responses I've given, we are making maternal health a major focus. There is no reason why a woman in this country today should die as a result of birth of a child. It's even worse, of course, for the child as well, now growing without his or her mother. And so we're going to do everything we can. We're encouraging states to join us. I mentioned the program where we're going to expand access to postpartum care to 1 full year instead of just 60 days. But we need states to buy in. So I would encourage you to go back home and chat with your folks in your state of Michigan.
But I wanted to specifically encourage you to incorporate doulas. We know, especially in low-income areas, sometimes the doulas that are in the community are the only support system that can help nurture a woman through her pregnancy and post-pregnancy. So my ask specifically is for please continue what you're doing. And I want to continue fighting, but I know how important the doula component is to ensuring maternal health.
You all are moving us in that direction through some of the legislation that's been proposed. We understand the importance of some of the paraprofessionals. You don't need to have an OBGYN like my wife in order to provide good care.
Right.
In fact, she's one of the first ones who will tell you that if you get a person who can give guidance to that woman during the 9 months of pregnancy, we're all going to be better off.
And I just want to just remind, while I have these 2 seconds, is that foster children are wards of the court. It's on our dime and our responsibility to take care of them. They have been through more trauma than most adults, and our commitment to them through their mental health is extremely important. I thank you, and I yield back.
Thank you. What we've been through is the first round. What I'd like to do is proceed to a very shortened second round of questions. Secretary Becerra has a hard stop at 12:30, so what I'm just going to say is your question and allowing time for the Secretary to answer, we're talking about within the time frame of about 2 minutes. So if we can, so we want to, and thank you, Secretary. Let me begin by just saying that we have a shift in how we respond to behavioral health these days. I think the 988 will be able to direct calls to behavioral health, and we deal with mobile crisis teams and be able to respond to these crises. And these teams are being set up around the country. We funded these teams in 2 ways last year. We created a new pilot program at SAMHSA. We funded several community project requests from members who wanted to support these teams in their own communities. And they're composed of people who are trained with medical care, individual experiencing behavioral health care crisis needs, that versus law enforcement. We did a hearing here on that several months ago, and the result has been they're spread all over the country. Now, we're going to implement this program. How does the request, I'm concerned about states that do not have a robust crisis care and want to be able to follow up on how we're going to make sure that this new system in place is really working and so forth. And how are we going to ensure that the individuals are going to be linked with that care?
Madam Chair, we just did another stakeholder meeting on this. We've done several on this. We're doing everything we can to shepherd this within the states. I just finished having a conversation when I was in Colorado with one of the leaders, executive leaders at the Western Governors Association, reminding them that we're ready to work with any state and any governor who wants to work with us to make sure that they are ready to go. We don't want anyone to be at the back of the bus when it comes to how you handle this. And so we're doing everything we can. We're providing resources. I will say to you, and I say this to each and every member, help us make sure that your states are ready, because we can't dictate to them everything. We're trying to use the carrot, but the stick comes when some kid calls and ends up with a busy signal.
Right. Thank you, and we need to deal with the resources, but we need to deal with the oversight to make sure it's happening. Absolutely. With that, let me recognize Congressman Cole.
Thank you very much, Madam Chair. Mr. Secretary, I want to go back very quickly to this issue of additional money for COVID relief, because I have very little to quibble with what the department is asking for in terms of what the purpose is going to be. Do you have a clear understanding, because we get all kinds of figures that are hard to nail down, about how much unpurposed money there is and specific accounts and what have you that could, if we could come to an agreement, be diverted to give you the resources that you need to tackle the problem as quickly as possible?
Unpurposed, the numbers are fairly small in most cases. Provider Relief Fund, for example, we have reached almost the $186 billion that was made available. There is some still available that is kept to make sure that we didn't miss any particular claims, didn't do them right. There was some money that was going to be used, for example, for testing. We're going to probably have to figure out if we can reprogram to meet needs, but most of that money, as far as I can tell, has been purchased.
Is there money, and look, these are never popular decisions to be made, I get that, but it's gone out the door, particularly to state governments, that's not being used for COVID, that could be repurposed, quite frankly. And that's a political problem for us, but my understanding is there's quite a bit of that there. I had very little problem, honestly, with the administration proposal or the legislative compromise on the COVID package that was stripped out. Fine, let's take that money from these states where I know it's not being used for this. This is more important. let's do this. And I'm sorry that honestly wasn't part of our package moving forward. I think we ought to revisit that, find another way legislatively, not to bore everybody with the stuff because everybody here knows it, but, that came down on what's called a rule vote. It wasn't the vote of the substance of the policy. We didn't disagree with you on the policy. So if you could help us at least get a clearer vision of what's available. It's our decision, not necessarily yours, but I do think this funding issue is going to get in the way of letting you do the things that I think need to get done as a department, and that we don't disagree with you. We just got to use some of this other money that was not directly COVID related that went out the door.
I appreciate the way you framed it.
Okay, thank you very much. Yield back, Madam Chair.
Congressman Roybal Allard.
Mr. Secretary, as you know, every year, 4 million babies are born in the United States, and nearly every one of those infants is screened by newborn screening programs for certain serious or life-threatening heritable disorders and medical conditions that can be treated. And on average, newborn screening saves or improves the lives of more than 12,000 babies each year. My Newborn Screening Saves Lives Act passed in 2008, was reauthorized in 2014, and we're currently working to get the House passed 2021 reauthorization bill also passed in the Senate. The Newborn Screening Saves Lives law established national newborn screening guidelines. It ensured the quality of laboratory newborn screening tests and established grants to help states expand and improve their screening programs. Also, to enable them to educate parents and healthcare providers and improve follow-up care for infants with a condition detected through newborn screening. The subcommittee has recognized the critical role that both the CDC and HRSA programs play in protecting our children, and has been providing generous increases to them each year, including $25.8 million for the HRSA programs and $23 million for the CDC Quality Assurance program in last year's House bill. Unfortunately, in the final FY22 bill, both of these programs received $19 million appropriations for FY22. Well, this funding is in fact significant. It unfortunately falls short of what is needed to meet the needs of the CDC and HRSA screening programs. I applaud the President's commitment to advancing maternal and child health, but I was disappointed to see that he requested $19 million for both the HRSA and $19 million for CDC newborn screening programs for FY23. I hope that I can get your commitment to work with me to ensure the viability of these critical screening programs through robust funding in the final FY23 appropriations bill. And my hope is that until this law is authorized, that you will ensure that the life-saving programs continue and the Secretary's Advisory Committee is able to make its critical reviews.
The gentlelady's time has expired.
I just need a yes answer.
I understand that, so got to get to yes.
Madam Chair, I want to give a straight yes, but what I have to say is that the funding levels that we put in, again, as I mentioned before, were based on what we thought we were going to have based on the continuing resolution. So we are absolutely committed to this. The President has in his budget, and CDC is committed to this program.
Thank you. Congressman Harris.
Thank you. Thank you very much. Briefly, I just want to ask about the expansion of fetal tissue research at HHS, because I'm curious about this, because the Trump administration did not ban fetal tissue research from extramural researchers. What they just said is you have to come before an ethics advisory board. Now, interestingly enough, 13 of the 14 research proposals that came before that board actually were found not to pass muster at the ethics advisory board. What's the thinking behind not requiring, and again, I served on the Special Investigative Panel on Infant Lives. I mean, some atrocities were being committed at clinics with regards to making profit from selling baby body parts. That's what the panel found. You can read it, Google it, read it. What's the thinking behind not requiring an ethics advisory board just to review these research projects that would use fetal tissue from aborted fetuses?
Congressman, I'm going to be real honest with you. That was not one issue I'm prepared to respond to because I don't know the details of it, but we can get back to you.
I would greatly appreciate that. Again, you know, it's not, now for intramural research, the Trump administration did ban it, and one might argue that, well, maybe you should just have an ethics advisory board for that too. But my particular question, I appreciate you getting back to me, is about the extramural research, not because of some of the things that came out of University of Pittsburgh. You can read about some of those experiments. I just think these should go to ethics advisory boards and let the chips fall where they may. Thank you very much.
I appreciate that, and I'll get back to you, but I know that there are standards and protections in place, but let me give you a thorough answer.
Thank you very much. I yield back.
Ms. Lee.
Thank you very much. Mr. Secretary, following up on our discussion, and you were there with our beloved, the late Supervisor Wilma Chan during your visit to my district. My colleagues and I sent a letter, this was something we discussed, to HHS to lead a national food as medicine pilot program using food as medicine in a clinical setting to help our healthcare system improve health outcomes for the underserved. And our colleague, Congresswoman Shelley Pingree, who serves on the Ag Committee along with myself and our chairwoman, has championed food as medicine for many, many years. So this pilot would be modeled after the work being done in my home county, Alameda County, as part of the county's all-in Recipe for Health initiative. But our intent, though, is that we establish a national pilot program that could expand the efforts of this program to integrate healthcare, regenerative agriculture, economics, and the environment to improve health and racial equity and food security. And so I'd like an update from you on your plans to look at this as a national pilot, to develop a national pilot for this.
Congressman, first, thank you for pushing that. Secretary Vilsack and I have had some conversations about how the Department of Ag and HHS can work together on this issue because we agree completely that food should be considered medicine. And so we will follow up with you on some of the details on what we're doing. By the way, we hope you'll join us in the work we're trying to do to reduce sodium in our food products. You can buy a bag of potato chips in the U.S. that has probably twice as much sodium in it as it does the same product in Europe. And we have to make sure that we're not the place where some of these manufacturers try to, entice us into getting into some of these things that aren't good for us. So I look forward to working with you because we agree. Yeah.
Mr. Fleischman.
Thank you, Madam Chair. Mr. Secretary, just one topic. Last year, Mr. Secretary, we discussed at length the issue of safely resettling unaccompanied minors who cross our border into ORR facilities.
Yes.
The safety and well-being of children should be of the utmost concern to the administration and to members of the subcommittee. In my own district, a contracted ORR facility was shut down last year after instances of sexual battery were reported to authorities. My question, Mr. Secretary, what, since the last time we spoke, has the administration done to better oversight and ensure safety net procedures throughout the contracting and hiring process of these ORR facilities? And, sir, how will the President's budget request of $6.3 billion be used to remedy this issue, sir? Thank you.
Congressman, thank you for that question because, again, we have custody of these children who have come unaccompanied during that temporary period that they're in the U.S. And I will tell you that we are bending over backwards. Anytime we receive a report, whether or not, we don't try to determine if it's true or not. We report it to local law enforcement. We report it to our Inspector General's office, and we get on it. And as quickly as we can, because as you mentioned, most of these are contractors that we're working with, we make sure that they move to make sure if there is an instance where a worker has violated rights and committed some activities that's inappropriate, that they move on. And so we're doing that as much as we can, and we're doing everything we can to make sure we keep the oversight going in these places.
Thank you, sir. My final request is that perhaps somebody on your staff would get with me. Your office has been working on a constituent issue, and I would just like a little bit of an update on that when it's convenient. But I thank you, sir, and I appreciate your being here today.
Your staffer's name is, can you give me your staffer's name so I know how to tell?
Oh, sure. I would call Daniel Tidwell.
Daniel.
We'll
Okay.
make him famous
Make sure my
today.
team's listening. We can.
I like him. Good to see you.
Thank you.
Ms. Frankel.
Thank you. Thank you again for being here. And I'll follow up on this, but just for the record, I wanted to say that your answer to me on enforcing the Affordable Care Act's contraceptive coverage, that really wasn't the best answer. So, but I'll follow up on that. I'll ask you another question. 90% of pregnant women report taking a medication during the pregnancy, but only 1% of clinical trials mention the word pregnancy or pregnant. The Congress did create a task force to take a look at that. There was a report with recommendations, and then another report with implementation recommendations. And I'm just, do you know where we are with that?
Congressman, I'll have to get back to you on that.
Okay, well, okay, then you got two things to get back to me on now.
Look forward to it.
And maybe I'll give you an easier question here. I know that your budget does have some increases on the home care and so forth. Could you tell us what that does and what that means?
We are going all in on home and community-based care. We believe that every American, whether they're going through an infirmity or whether in their last days, should be able to be with loved ones through that difficult time. And so we're making major investments in home and community-based care. We're going to try to increase the workforce and recognize that the workforce in those settings has to be paid decently so that they'll remain in there. We want to recognize that in some cases family members are the people who are caring, and just because they're family members doesn't mean they don't deserve to be compensated where possible. And so we're going to do everything we can to make sure if you can be at home, we'll let you stay at home. If you can't be at home, we want it to be in a setting that's as close to your home as possible. And we applaud those who are providing services in nursing home and other long-term care facilities. But to the degree that we can move care to where you live and where your loved ones are, that's what we'll try to do.
Okay, thank you very much. Yield back, Madam Chair.
Ms. Herrera-Butler.
Thank you, Madam Chair. I wanted to follow up on the fentanyl conversation a little bit. In December, the DEA issued a warning about the alarming increase of fake prescription medications obviously being laced with fentanyl. And in Lewis County, Washington, the Joint Narcotics Enforcement Team seized 106,000 pills suspected to be laced with fentanyl as of September of 2021. Mr. Secretary, what will you do to ensure that HHS continues to work not only on the treatment, but the prevention piece? And I wanted to make sure you're aware, many of the traffickers in Mexico are targeting children via social media, right? So they can access these fentanyl-laced drugs. I mean, that's the whole new horrible game. What can HHS do to increase awareness to protect our communities?
Congresswoman, as you're probably aware, we have changed direction in terms of our strategy. We're not just trying to treat, we're now trying to help prevent. And one of the ways we do that, for example, we're letting go some of those taboos. We're forgetting about how things were done in the 20th century. A fentanyl strip, it used to be thought, well, you don't want to give people something that helps them test to see if the drug they're about to ingest also has fentanyl, because you're just helping them take a drug. The problem, of course, is that too many Americans, I think they're taking a illicit drug nonetheless, but not going to kill them, and lo and behold, it's laced with fentanyl. So we're now supporting those local efforts that have shown that fentanyl strips help save lives. And so we're going to try to do what we can to prevent that and then follow people through the process as well.
I appreciate that. I'm just going to go out on a limb here because I know everybody in this space is saying we need to do things like test the drug so that someone can ingest it safely. But I'm not sold on the science behind that yet. I still, I grew up in the don't do drugs. And man, I can remember the commercials. I remember the message. I remember those were the things we talked about. And I believed it, silly me. And I feel like now with recreational use in Washington State by 2023, you can use meth and heroin, not just marijuana, in front of cops and not go to jail for it. And my concern is the message we're sending to the next generation. So I know that this is where a lot of the new talk is about going, but that concerns me. And I want to see science on it before we move in that direction.
And so, Congresswoman, I don't want to give you the impression that that's the only type of prevention work we do. We actually devote the majority of our resources to actually prevent people from ever using drugs. We're working closely to try to keep children, especially in the middle schools, from getting to the, that's about the time they start using recreationally. And so we're doing a lot in that space. But we also don't want to forget those who are beginning to use, keep them alive, because hopefully we can move them in a different direction.
Ms. Lawrence.
Thank you. I have a question because we are experiencing child care deserts. I just had a conversation with my lieutenant governor where when we tour the child care facilities in low-income areas, there are waiting lists. And so as we look at addressing and complimenting you on the president on the Child Care and Development Block Grant and Head Start, we need to do something different in those areas where we know we have challenges. And so can you talk to me about that? In addition to that, what are we doing to ensure that we have a workforce that can address the deserts and the shortage that's happening in low-income areas?
Congresswoman, this is where I hope I can convince you that my own personal beliefs and upbringing mean that we will have equity infused in everything we do. We proved that when it came to the Affordable Care Act. A lot of Black and brown communities were not participating. We raised the bar when it came to the participants, and we got the numbers of Black families and Latino families that signed up for health insurance under ACA to levels they've never been before. When I came into office, the number of Black and Latino families that were getting vaccinated was well below what we saw for white America. Today, they are almost all at the same level. And that's because what we're doing is we're going to where they are instead of waiting for them to come to us. When it comes to childcare, it's the same thing. Most of the caregivers we know are people, if not women of color.
Yes.
And so we're going to do everything we can to make sure we elevate those caregivers and that workforce. At the same time, we make those services available. So if we get the dollars to expand access to childcare, we're going to work with states to make sure that they're also making sure they're providing that extra care.
I'm going to be reaching out to you. We do accelerators for other type of businesses and shortages that we see. We need an accelerator to train professionals in childcare.
Look
And I
forward to
would want your partnership. Thank you.
Look forward to talking.
Mr. Klein.
Thank you, Madam Chair. Mr. Secretary, you're committed to upholding and enforcing the laws that are on the books in this country, correct?
Correct.
All right, can I get a yes?
Yes.
Okay. The Title 10 statute itself says that abortion is not a method of family planning and taxpayer dollars should not be used to fund abortion providers. Can you tell me how it has come to pass that HHS is awarding $6.6 million to Title 10 funds from the American Rescue Plan to abortion providers?
So, Congressman, as you probably are aware, the services that are provided by a number of the family planning programs go well beyond just providing contraceptive care or abortion services. They provide the full panoply of services that you think of in terms of family.
You don't view it as a disqualifier,
All the other things
the fact that they provide abortions?
If you are following the rules of the law and you qualify, you should be able to receive the funding. If you're providing family planning services, you should be able to get family planning money.
Okay. Let me move on to Title 18 of the U.S. Code, Section 1531. Last year, you claimed there's no law dealing specifically with the term partial birth abortion. This drew a lot of attention, was roundly debunked. You voted yourself against this law when it was considered by Congress. You've repeatedly committed to enforcing these laws, as you just said. That extends particularly to laws which you disagree, like laws that protect the unborn. Will you commit to enforcing this law against partial birth abortions?
Without question, Congressman, I will not only comply with the law, but enforce the law.
Thank you. I yield back.
Thank you. I'd now like to yield to Congressman Cole for any closing remarks he may have.
Thank you. First of all, Madam Chair, thanks for holding the hearing. It's good to get back in purpose. And again, thanks for your hard work in getting our last year's bill done across the line. Mr. Secretary, thank you. As always, you're forthcoming. We don't agree on everything. We're going to disagree very strongly on Hyde. And I just want to underline that triple fold. I respect the president to submit what budget, but at the end of the day, if he wants bipartisan support, that's going to be an issue we're going to have to confront. we're just not movable on this. I'm very interested in the ARPA process. I appreciate your commitment to keep in touch with this as these decisions are made. Count me as very skeptical that we could hit the administration's proposed number, because I just think it's going to take longer to set this up and organize it than perhaps you envision. And I think that money would be better redirected toward NIH and traditional biomedical research. Finally, I want to reiterate again, thank you for the bold stance that you took with respect to how we fund the Indian Health Service. That's a big deal. I know that that will actually not be a partisan fight. There will be people on both sides against it. I think, I respect the fiscal discipline. I just don't think it needs to come at the expense of the health care of this population when we have made commitments over and over again. And your willingness to step out front and offer some bold new thinking. I don't think any other administration that I'm aware of on either side of the aisle has ever proposed doing what you're proposing here. So to my colleagues, this is a really big deal in Indian country, and the Secretary and the administration are to be commended for it. So I'm hopeful that at the end of the day, because it's sort of like the wonderful working relationship I've had over the years with the chairwoman, we don't agree on everything, but we get to a deal. And we've been able to do it 7 times in a row, and you're very much part of this deal-making process, obviously, in this particular subcommittee. The administration has to sign anything we produce, so you have as big a seat at the table as anybody else. But I appreciate the manner in which negotiations were done last time, and I had several discussions with our good mutual friend Shalonda Young, our new OMB director. We're very proud of her, great appropriation staffer. And frankly, she helped me on a number of occasions clarify, okay, this is really important to the president. And even if I don't agree with the president, what's important to him matters. And certainly when we have to come to a cooperative deal. And we were able to do that. But I just end by saying we won't always agree on everything, but I appreciate you being there. You've been accessible. You've been good to work with. You've been fair. You always keep your word. And it's a pleasure having the opportunity to work with you again. I look forward to it in the coming year. Yield back.
Thank you very much, and thank you, Mr. Secretary. It's wonderful to be with you in person. It was virtual last year, but this is, and just to really in person to offer congratulations. So delighted you are where you are. I can recall so many meetings, over and over again with the two of us, and we're so like-minded on so many issues, and oftentimes in our Democratic leadership meetings, we stood together. So I really appreciate your remarkable professional history and your service here in the Congress, and the values that you hold, which is what drives you in terms of the public policy initiatives that you care about and you put forward. And I too will say to my colleague that we did work cooperatively. In the end, we got the bill across for 2022, and I think we made some very, very important investments in biomedical research, public health, behavioral health, childcare, early learning, and so many others. And that was after years of austerity with regard to some of these efforts. And what you've done with this budget is that you have now, provided the opportunity to build on that success, and whether it's through public health or maternal health, behavioral health, all these things we talked about today, the NIH, ARPA-H, early childhood, et cetera, the range of issues that fall within the mission, and it is a mission at Health and Human Services and what you do. We need to provide additional emergency funding. I think there is a morality about the COVID pandemic, and that it is about life-saving vaccines. It's about therapeutics. It's about covering the uninsured. And I worry about the uninsured and what will happen to them if there isn't a funding there, and then therefore we will see less people getting the tests and vaccinated, et cetera, which is harmful. And I think also I would emphasize our global efforts as well. I think we have, again, real moral leadership to lead there. What is really this investment with people, and if I might just say for a moment, that for years, federal resources have gone oftentimes to the richest 1/10 of 1% of the people in this nation, or to a number of the corporations who, the biggest corporations who don't pay their fair share of taxes or pay taxes at all. And for me, looking at the shift in where federal resources have been going, and looking at the rescue plan, looking at the bipartisan infrastructure plan, I know we will get to where we're going on some package with regard to Build Back Better that will continue this effort of looking at our federal resources, that they are going to children, they're going to families, they are going to state and local government, they're going to small businesses, and they're going to where they need, with allowing people to have the economic opportunity for security in their future. And the budget you have presented reinforces all of those efforts. So look forward to working with you and with my colleagues, both sides of the aisle, as we move forward on what we look forward to as a strong spending bill for 2023. So thank you for your time, thank you for your work, and thank you for your commitment and devotion to public service. Thanks so much. It's great to be with you. Thank you. Let me call this.